My name is Jürg Hodler, as has been said. By profession, I'm a radiologist, so I'm more or less at the opposite end of medicine than the group probably sitting in here. So I had to get some instructions and some information from Dr. Witt. As a physician and as part of a hospital board, I always have to ask myself what patients in the end want. And patients have expressed themselves very clearly in Switzerland. Those who have been in Switzerland in 2009 probably recognize this. This is a typical screenshot from a newspaper's webpage, which you will find on a Sunday afternoon after voting. And in 2009, the Swiss people voted regarding a constitutional article in complementary medicine, as it was called, Komplementärmedizin in German. And you can see all these grades of green. No red. Red would be rejection. Green is in favor. There is one single county, I think this is Simmental in Bernese Oberland, which was between 50 and 55%. All the rest was far more in favor. Even more so in the Western French-speaking part than in the German-speaking part of Switzerland. And being foreign to complementary medicine, I must admit I was astonished. But this was a very clear message to me. This is an important topic, and we have to address it. Now, what has happened meanwhile? All these remarks here are from a recently published report by the Swiss FDA, Bundesamt für Gesundheitswesen, which was published on the 13th of May 2015. What has been done meanwhile, or what is planned? Number one, we have a constitutional article, which is really something important to be in the Constitution. We also have several laws giving information about complementary medicine. One of them is procedures need to be effective, appropriate, and economical. So complementary medicine may have a more difficult task here than other types of medicine, but this is an important part, and this is where University Hospital and University of Zurich certainly come into the picture. I have translated that. I don't know if that's a very good translation. A Compulsory Healthcare Insurance Act. In Switzerland, everybody has to be insured by law, and complementary medicine is included in this act. So another sign of the importance of complementary medicine in Switzerland. The rest here is in part future, but near future. There should be easier market access for complementary medication, for instance. All the MDs and related professions need to be trained at universities. This is compulsory. Universities don't have a choice. And there are some federally regulated examinations, or there will be federally regulated examinations, like the Healers, Naturheiler have something like that already. And finally, all that has been in the basic coverage of our healthcare system will become permanent, and you see here the list which is included in these regulations. So complementary medicine or integrative medicine has become part of Swiss healthcare. Now, what is a specific responsibility of a university hospital as our own hospital? We certainly have to offer a wide selection of treatment options. And when patients want this type of treatment, we certainly have to offer it. We are certainly responsible not simply to do everything. We have to provide rational care. So we have to provide data, we have to measure, we have to prove things, we have to look at long-term outcome and also economical viability. That's why it's so important to have an institute doing that and to having a professor doing that at our hospital. And something I have learned as a radiologist, I'm on the technical side. I get excited about some MR sequence, but I have realized that not all patients get excited about new MR sequences, but some of them have other selections, and that medicine is not all high-tech, but that integrative medicine has its place. Now a little bit more specific about our team, which is led by Professor Witt, whom you know. She has become a recognized expert very quickly. She has been here for less than 2 years, and I can tell you not all of my colleagues really were, well, let's say they were critical about complementary or integrative medicine. And she has overcome that. There is no discussion anymore. She has found successful cooperations like with oncology, radiation therapy, etc. And what I think is important, it's not alternative, it is complementary, which certainly helps to get recognition. And what is the absolute requirement in this hospital and in this surrounding? She is recognized as a scientist. This is really something important. Without that, you can't survive in the university surroundings. What I personally found very interesting, because I have a certain interest in economics, is the transfer of theories from the economic side into medicine. I think that's a very interesting approach, and I will not be able to stay for the entire course, but I'm looking forward to get at least some input of the results of this idea, as I have realized that several of her former or current partners are speaking during this course here. This is something which I always also think is very important. You know, when we talk within Switzerland, that's a small country, and we will remain very provincial if we don't have international contacts. And also Germany is quite near to us, similar language, similar culture. So I think it's very important that in a course like that, I can show a world map and people from 3 different continents are speaking here. Now, when I conclude my short introduction, we have realized that integrative medicine is requested by our patients, so we certainly have to deal with it. I also can clearly state that integrative medicine is well accepted in this hospital, and a successful part of what we provide in patient care and innovative research is performed here, and this is the basis of USZ Integrative Medicine. This is the end of my short introduction. I wish you a very interesting course, and I hand over to whom? To you.
Thank you.